it's Dr. Mish, board certified naturopathic physician.
And I'm Dr. Yusupova, Doctor of Pharmacy.
And today's topic is acne.
Which is a very important topic because I'm sure, as all of the viewers know and we know, a lot of people suffer from acne.
Yes.
So what are the causes of acne?
So acne vulgaris, which is the most common type of acne, is caused by a lot of different reasons. Whether it be hyperkeratinization, which is a plugging up of the follicles, bacteria such as P. acnes, inflammatory conditions, and hormonal imbalances.
Okay, and what is the most common type of acne that people tend to have?
A most common type of acne is definitely acne vulgaris. It is the most common amongst teenagers and adults. It is mostly located on the face, the chest, the back, and yes, the shoulders.
Wow, okay,
Yes.
okay. I know that there's another condition, skin condition known as rosacea. Is there a difference between acne and rosacea?
Yes, there's a huge difference between acne and rosacea. Rosacea is a genetic issue. It's an inflammatory condition. Whereas acne is genetic, but it is somewhat, it is also
like internal.
Yes, internal, and also external factors play a huge role in it as well.
Okay, so let's say if I wash my face several times a day, and I've noticed that, and I have a pretty good skin regimen, why do I still get acne sometimes?
So actually, people think, oh, let me wash my face over and over again. They think that it's going to be helping them reduce their acne flare-ups. But in reality, you're actually stripping away all of the essential oils and moisture from the skin, therefore causing it to be depleted in moisture and nutrition, and therefore causing it to create an environment that's more prone to acne.
Oh, okay. Does stress cause acne?
Oh, most definitely. Stress is a very important contributing factor to acne vulgaris. It causes cortisol, increase in cortisol. And actually, the sebaceous glands, which produce the sebum in the hair follicles, they're actually prone to, they have receptors for stress hormone.
Oh, wow.
So when you have an increased stress, whether acute or chronic, the stress hormones, it's called CRH, it binds to the sebaceous glands and it increases oil production, therefore causing more acne.
Wow, so that would explain a lot of things, because I never had acne as a teenager. That's probably one of the reasons that I'm getting it as an adult now sometimes. Why else can you explain that I'm getting acne sometimes as an adult?
So a lot of people ask me these questions. What happens is, as an adult and in the aging process, we get older, we're constantly exposed to pollutants and environmental factors that bombards our skin, causing it to age prematurely. Just gunk gets stuck in our pores. And as we age, we have higher amounts of stress.
How about a diet? Does diet affect it?
Yep. Diet is probably the number one reason as to diet and hormones. So with diet, sometimes acne vulgaris is considered diabetes of the skin.
Oh, wow.
So a lot of acne issues comes from within, and your skin is the largest organ we have in the body.
Right.
It covers our whole surface area, and when something is going on with your skin, it's your body telling you, hey, something's going on inside. It's your calling card, to let's see what's going on and try to figure out how to fix this. Your skin is helping you.
So, I've noticed that now the sun's out more than before, and I've noticed that sometimes when I go get a tan or when I stay out in the sun, my face looks more clear than it did as if I didn't. So does the sun help acne?
So there is a lot of myths behind and false accusation, or not accusations, but myths, I guess you can say, about the sun. So the sun obviously emits UV light, which actually changes the color of acne and dries the oil out, which it maybe instantly gives you a better result and causes the acne to go away. But in reality, you're damaging your skin. You're stripping away essential oils and moisture as well, and therefore causing premature aging.
Wow. What is the best way to treat acne?
So I don't believe that there is a best way. I think that it's a multi-dimensional process. There's diet, which is, I believe, number one. What you feed your body, when, especially in our Western culture, it's called the SAD diet, Standard American Diet, which is high in refined, simple carbohydrates, trans fats, saturated fats, and that wreaks havoc on our digestive system and our immune system.
Wow.
In addition to making beneficial changes to our diet, things such as herbs, nutrients, nutraceuticals, and topical applications that are safe and natural are the best ways to target acne.
Okay, so back to the diet thing. So sweets, dairy, nuts, are those all things in our daily diets that contribute to our acne breakouts?
Yes, actually. So a lot of our food, unfortunately, is loaded with hormones, such as milk, dairy products, even our chicken breasts are, just bombarded with hormones.
It's a shame.
Exactly. So, of course, if the hormones are affecting the animals, they're going to affect us too.
Yeah.
And since acne is regulated by hormones and can be exacerbated by hormones, eating foods with hormones in them causes an increase in acne.
Flare-ups.
Yes.
Okay, so now someone has acne, right?
Right.
So now, of course, we cannot walk around with acne. What kind of cosmetics should an acne patient use? What is the best type of cosmetics that an acne patient can use?
So, first of all, I love cosmetics. As a woman, there's a lot of products, and it's very misleading and misguiding to people who do wear makeup. And what's important when you're picking out makeup is to buy hypoallergenic, things that are natural products. Do your research on the makeup products.
Yeah. So there is stuff out there for acne patients.
Yeah, and also you want to make sure that there is no hidden estrogens in the makeup or the skincare products, because again, it's not only does it cause acne, but it has a lot of other detrimental effects.
Okay, so sometimes when you have a flare up or a breakout, it's in your face and you're constantly looking at it, and everyone always wants to squeeze it or pop it. Is that something that is allowed to do, or is that something that is totally not allowed to do?
Well, yeah, I've definitely been guilty of that, but it's highly dangerous actually to pop your pimples.
Wow.
Because when you're squeezing the pimple, all of that stuff that's trapped in the whitehead and the blackheads, you actually are pushing it deeper into your skin, which then can actually get dislodged and go deep, can actually travel up to the brain or anywhere else it's on your face, it's close to your brain, so it can cause a lot of things that are harmful for us.
And I know that sometimes when we do pop the acne or the pimples, there's a lot of scarring that occurs. So is there anything that can be done about scarring of the face caused by popping? Or even the acne itself, when it goes away, I've noticed that sometimes there are some scars left on the skin.
Right. So I actually deal with that. I don't have a lot of acne, but I notice that when my acne does go away, I do notice the scars. And there are a lot of topical applications that you can put that are safe and effective. you obviously have to take into consideration the type of skin that you have, whether you have dry, normal to dry, oily skin. That all plays a role. Things that you can use as scar reducers are manuka honey, right on the spot, tea tree oil diluted,
Oh, okay.
lemon water, just as a spot treatment.
Right.
Basically, just gentle exfoliation of the skin. There's also a product that I've been using, relatively new on the market, but there's been a lot of great reviews, and I live by it. I use it every morning before I put my makeup on, and every night before I go to sleep. It's called Acne H by Weisenweiger. It is completely 100% natural. It's made with herbal ingredients that are specifically tailored to decreasing acne breakouts, helping scarring. And it's a clear liquid. It's a clear liquid, but it has more. It not only decreases acne. It's not only used for acne. You can actually use it as a toner and a makeup remover.
Right.
So I love it because sometimes I notice when I wash my makeup off at night and I'm thinking that my face is clean and ready to go to bed, I notice that once I started using this, I dab a little bit onto the cotton swab, I wipe my face, and I notice that there's still makeup residue on the swab.
Yes. Mm-hmm.
And so I'm like, oh wow, I really didn't clean my face well. And it just goes to show that's another contributing factor as to why I may get a little bit of acne here and there.
Okay.
So,
and if, let's say, doctors prescribe medications for acne all the time,
right?
How long do you think there are visible results from using any type of medication, whether it's internal or external?
So, you know what, with acne medications, before I answer that question, I'm just going to say the conventional treatments are highly dangerous. They use a form of vitamin A, which in high concentrations are actually extremely, extremely potent, and they damage the liver and other vital organs, and they just have a lot of health risks. And they're teratogenic, which means they could cause injury to an unborn child.
Right. That's why there's a lot of black box warnings, it's called, on some of these medications, that if you are pregnant or think you are pregnant, do not administer them.
Right. The reason why people do tend to go to the conventional is because a lot of, in our society, everybody wants quick fix. And so, yes, you will have a quicker fix with a conventional treatment. Being of the naturopathic background, I know, I'm not sure exactly how much time, everybody's different, but yes, it is a faster result, but it's far more dangerous and health concerning than using natural ways to tackle the issue. Because, changing your diet, changing the way your skincare regimen, taking, exercising and all of that stuff, nobody has the time or the want to do those things. We're in a technological world and people forget. But you have to put in the work.
So it's like a lifestyle change. So
it's a lot of lifestyle, correct?
I agree. I think that with the proper dieting, proper lifestyle changes, taking better care of your skin, exercising, and of course using Acne H as your daily skin routine, you would be able to, I believe, see long-term results versus just a quick fix. 100%.
And also, in addition, doing all of that also balances out your hormones, your stress level. It's a great way to relieve stress. All of that plays a role. So
let's say if my face cleared up and if I don't have acne anymore, should I stop the lifestyle change? Should I stop using Acne H?
No. So naturopathic medicine, natural ways, is a way of life. It is forming new habits. It is forming new ways of doing things. People who are suffering from acne, it's your body, like I said before, telling you, hey, something's not right, something's out of balance. So in order to prevent that from happening again, you have to live a balanced lifestyle. It doesn't mean that, hey, you can't have a burger ever again, or you can't have chocolate, or you can't have sweets, and of course, everything in moderation.
Right.
So I think I believe that that's very important, to do everything in moderation. And you know what, to prevent things from happening, I think it's important to continue with the proper skincare regimen to prevent early aging, or prevent wrinkles and acne, scars, and all of that. Because as clean as you can live, anybody have acne.
So this is something that can be used on the face as well as on different types of the bodies, as you were saying.
Correct.
Okay.
Yes.
Okay, so I think it was actually have a review from a patient that said that her teenage daughter has acne on her back, and she was using Acne H that she ordered online, and it actually cleared up.
Yes.
She just actually sent me a text message today saying, this is such a great product. During the past holidays, they were with family, and they said, your daughter's face is so clear. What have you been doing? And she is prime teenage. She's like 13, 14.
Oh, yeah.
So it's a great product. So I think you can order it online as well as some pharmacies. You can also ask your local pharmacy to contact the producer, and I think the best way to do it right now is online.
I think the best way is online, and
I think acneh.com.
Yeah, correct. ACNEH.com.
Yeah, it's right on the bottom. acneh.com, and they'll ship it to your house.
Oh yeah. I believe they give you a deal.
Oh, okay.
Yeah. So, it's I'm not gonna. I personally use this product, and I do get a lot of compliments.
Yeah,
about
I do too.
How clear my skin is, and what do I use, and of course, besides the whole lifestyle, Acne H is part of my daily routine. Sometimes I even do it more than twice a day if I, just the monthly hormonal changes cause that. So I live by this.
And I'm going to say I have a lot of acquaintances in the cosmetics industry, makeup application, that apply makeup, that wear a lot of makeup just for their business and their companies. And I've recommended this to them, and they've used it, and they've had great results too. So if you are into makeup, or you're a makeup artist, this is a great product for you too. I think this was a pretty informative conversation. Thank you for your time, Dr. Mish.
Thank you for having me.
Yes, and hopefully this is not the last time you'll be seeing us.
Oh, definitely not.
Yes.